and then separated by 2 tabs. This one, again, has the option for you to print the second page, or printing both if you hit print page. Save and close. Again, it's tracked in the encounter action tracker. Moving over to the snap. Selecting the sex of the patient. Whoever that this was for, the teacher or the parent. Again, entering values via the radio button. And at the very bottom here, we have a spot for the total score. The team functional assessment was a little more concise than the previous, and we entered a mix of data elements here. So this one is with a drop menu. We've taken all the answer options that were given to us on the form, and we just decided to make it a drop menu to make it a little more concise, a little cleaner, and we have some features here for text. And I should note that just the one for the adult module, anytime you're entering data into these fields, it's all entered, they're all linked via HRIs, and they all become metadata. So anytime you want to run a query, all of this data can be mined as well. Moving over to the form that we actually took some liberties with, because we felt it was very busy for the eyes, so we kind of just split it up and made it this, broke it down and simplified it. And we have all the original elements of the test, the tool for assessment of suicide risk, but we just split it up, and then it's just a little easier on the eyes, and we feel like it's easier to work with. So on the left-hand side, all the questions you would have found in the original form are over here. Enter the answers here, or the values via the radio buttons. We have a spot here for the 6-item CAD score. The previous discussion with the adult mental health module, this could be in the works in the future where it auto-populates the CAD score from the other form, and will automatically pull it into this form here. But again, that's for a discussion later on as a possible upgrade. Menu here for the suicide risk, and any additional notes you need to write could be here. And when it's done, you'll see that here it auto-populates the provider's details, so who completed this assessment and the date of the actual encounter itself. We'll go ahead and save and close. Moving down to the worry-reducing prescription. This one was fairly straightforward as far as what was provided to us, so we just took the original format and ran with it. We just entered fields for you to enter the worry-reducing prescriptions. And so forth. Well, that's the same with the mood-enhancing prescription. The short, I could not say that name, sorry, the SCKS, action through drop menus. Moving down, radio button here, edit field as a side result to this answer. Well, it's fairly straightforward. CYMH. This one was about like there wasn't much to do other than create one drop menu to action one of these answers. Next, we have the craft. So this is the substances use assessment. We took a few liberties with this form here. We basically stripped out the form and kept the questions only. So as you hear, we decided that it'd be a yes/no caption. Oops. And you require reference to the original form. We've also linked it to this form, so this is actually stored in the library. So if you were to click the craft form button here, it brings you to the original document should you need it as a reference point. And the questions that we took right here, the questions, and we also took the substance use screen for youth questions as well. Next, we're going to push over to the child and adolescent screening questions. This one we also modified. I believe we changed this because the original form, the background wasn't too user-friendly as far as the resolution on the screen. So we just stripped out and made it black and white, a lot easier to decipher with the eyes without having to strain. That was a feedback we were getting about it was just a little hard to see. Then it does hold all the original elements. Difference here is that this one is populated with a few more extra buttons than we're used to seeing in the other forms, and it's just because we felt like because if you answer yes to a certain question, we didn't want you to navigate through the library to find any additional library documents, so we just decided to link it directly to the form itself. Oops. Sorry, I will fix that. But all of these are stored in the library, and they'll link directly as a reference. So I just wanted to check, is everyone still there?
We're here.
Oh, good. Like, no one has said anything, so I got a little bit concerned just for a second.
No, we're here. Derek, I just want to mention your line actually isn't completely crystal. I don't know if there's any option to if you're on speakerphone, if you could move closer, but it's not horrible. It's just sometimes we get a little feedback.
Maybe I ought to move. Is that better?
It is better, yeah.
So I'm just going to move the phone where it's like underneath my chin.
Thank you.
It's OHCH. We were experiencing a delay in what you were talking about versus what we were seeing, but it seems to be working better now. So I'm wondering, and I apologize to anybody else, but I have no clue how you got to this original, like what steps you took to get to the child youth mental health, where you can click on all the different provider tools.
How about I continue running through this, and then again I'll redo that beginning step.
That would be great. Thank you.
No worries.
Thanks, Derek.
Yep. Next we have the letter requesting psychoeducational training. Again, some fields here that do the auto-populating for the demographics. And it's just hold on to all the original elements of the form. So just fill it out. And the request for school, which will be very much like the previous form. Just below the provider tools, we have the algorithm. So this is the master file where this entire module was based off of. So all the original forms and data elements are over here. If you ever need that as a reference point, that's where you would find it. Below, we have a separate field called patient material. So with the input of our power user, we separated these from the other provider tools, and these are more for your patient. So just like the provider tools, you just click the button and it opens up the link. This one originally felt like it was a form, but actually it turned out to be patient material. But it works like a form. So you can action via the radio button and then fill in the fields. And then you can print this out and hand this off to your patient. With something for this handout called safety plan. Likewise with the safety card. And have a child functional assessment. Originally, I believe we understood that this should operate like a form, but it's hard to interpret this part. So we felt it was better utilized as a printout because it was hard to scale exactly, on a grade, 0 to 10, 0 to 20. There wasn't really any marks or indicators. So we felt this was better used, printed out and handed off to a patient for them to complete. Next to each of these patient materials, so over here, the encounter fields box, to just help us keep track of what has been given to our patient. We click this, it keeps a check mark, but we move up. You'll also notice that it adds a little text to your encounter notes just to help you keep track of it. And later on when we hit save and close, they'll push all of this into the original encounter notes. A separate tab here for medication, and these are part of the Q measures. And we just wanted to keep it separate from the tools, but this is a way to track your patient's compliance with medications. We had a list of 6 here. Just as I click back to here, it pushes it into this encounter notes field. And anything additional that's not listed on the left side, we decided it would be beneficial to add another field to text about additional meds. And the same way, when I hit save close, all this will push into the encounter notes, which is what I'm going to do now, save and close. So it's pushed all that through. Things of action via the checkboxes. My original test chart notes here, and my note about additional meds as well. For those who are familiar with the PSP pain module, it requires that you code the encounter with a chronic pain diagnosis. In this case, because mental health is so broad in the scope, we don't have that restriction, but just like how we always recommend during clinical training that you should still code the encounter in, like so. Joe, this is how to access the homepage. So I clicked form when I was in the new encounter, and I could either search for it like so, or to browse for it. And it would be under your practice support program folder. CYMH for child youth mental health is this form here. All the other forms I had gone through exist in this folder as well. but again, the home page just for easy use.
Thank you. So you clicked on form and then new encounter and then form.
Yes, and you could search for it via the text field, or you can browse for it.
Okay, thank you so much. I'm just going to practice this today with that. Thank you.
Of course. Any questions? We really went through that very quickly. I didn't get stopped at all. Yes.
It's Corey and Jacob Hart from Fraser. A couple of questions. One, just of all the scared cats, et cetera, can you graph the results?
This one, no.
Okay, so it doesn't auto-score. Unfortunately, I still think the algorithm separate from the EMR is more useful. If this isn't self-scoring, I can see GPs rather using the algorithm one that does score, cutting and pasting, because it's not graphing the results. You're still having to add it up. It seems quite useful.
No, I definitely agree.
We created it for my health plan and profile in Fraser, and we had them all auto-scoring and graphing.
I believe Fraser has it separate from, I think Fraser has a different set of their own tools. But yeah, I definitely agree with you that obviously the auto score is nicer to have, and hopefully perhaps in the future we have this as an upgrade.
Okay.
Thanks. It's
Kelsey, being really useful, unfortunately.
Sorry?
Thanks, Erin. Point to it's Kelsey. I just wanted to offer a bit of insight. So certainly we take your point, and I think that everyone would agree that that is probably ultimately the most beneficial. With projects like this, though, we just some of these functions have to be incorporated in phases. And so we've done sort of the initial, I would say, legwork to get everything, all the elements and components into the EMR, and certainly we'll continue those dialogue with Intrahealth, the team there, to figure out how we can start to add these other additional functions. So point taken, and thank you.
Okay, thanks. And would you consider adding a confident parents referral form that was already right in there that could auto-populate as well, and they could just hit go? I know Leo's done that for Med Access, and it's very handy.
I'm not familiar with the confident parents form or letter.
Okay, it's a referral form. It's in the binder. It replaced Strongest Families, so for parenting skills, ADHD, et cetera, support.
On the algorithm button, you'll be able to find it.
Derek, I think it's in there. Sorry, what was it called previously?
Drop down.
Strongest Families.
On the drop down.
On the bottom. Oops. To the bottom on the left.
Underneath general resources, right there. That one.
Mentioned Dr. Leo Wong's kiddo. It's at Access, and it'll auto-populate from his EMR, and then he just needs to put a stamp and go.
Thanks, Erin. I mean, certainly I'm aware some of the EMRs have included this. It wasn't a necessary requirement in the initial scope of work that we had with all of them, but again, different platforms are customizable, in different ways by user or not. So in terms of referral resources and everything, it wasn't a priority for this first phase, but it is on our requirements documentation, so it's on the radar.
Okay, and I'll follow up with Bruce and I guess Eric about the craft, because the 4 initial questions that the original one and not on the one that got in the first wave of the binder, but was on the refresh, questions that dictate whether you go ahead and ask those questions, whether it's necessary to, aren't there either. So
okay, thanks. I sent an email, so just for everyone's reference, Erin was asking about, I believe, just the predictor questions for the craft, and I'm sorry, I'm beyond my clinical knowledge. So I will circle in with Bruce Hobson, who provided most of sort of the clinical direction, and get an answer.
Perfect.
Group. So, Derek, have we been through all of the tools?
We have. This one went a lot smoother than the adult one, actually. I'm a little puzzled, actually, because I recall that we did work with the competent parents one, actually, now that she mentions it.
Yeah, I thought
yeah, because I recall you and I talked about it at some point. So I'm actually a little puzzled. I would have expected, because I actually see it in my term set as well.
I just saw the acronym a minute ago.
Parents. Then I don't see it stored here, so I know I've seen it. Like I know I played with this. Huh. Okay.
Okay. Maybe you could do some stuff and just get back to us. I can provide the information, and then I can disseminate it through our listserv via email.
Sorry about that, because I know it exists because I see it in my term set, so it must have been here, but for one reason or another, it's not in this folder. We'll definitely relay with you, Kelsey, and send you a screenshot so that you know it does exist as well. But
yeah, I'm pretty sure we saw it in one of our beta test review meetings, so maybe it's just moved or turned off.
Yeah, about that.
That's okay. Could you talk a little bit, Derek, about just in terms of the QI measures, just how that would look? I know some people had some questions about some of the forms that might auto-calculate right now, but is there anything that we're able to chat in terms of reporting?
That has been done with Kevin. He is the business analyst that helped develop the QI measures and how to run the KPIs. Unfortunately, I couldn't grab him for this meeting, but because he has the KPI set up for his laptop there, and I only have this on mine, and I believe I can't grab him at the moment because he is actually tied into a different meeting at the moment, and that's why I couldn't grab him for this one. Did we get, my memory's a little short from last week, did we have a chance to show the QI measures?
Can I share these?
Did we have a chance to show how the KPIs ran in profile last week for the adult?
For the adult, I think we did look at something.
I believe, so I'm going to try to do my best to exactly what Kevin would say, but for those who are familiar with the objective data dashboard, it will run the same way. So included with the mental health package that Profile will release, included will be filter views that will be used with your KPIs in the objective data dashboard, and it will run the same way. So it would come pre-populated, and all you have to do is run the KPIs for each individual physician, or you could run it for a group of physicians if you like, but we just don't recommend that because it would slow down the system. So we always say run one provider at a time. And the same way that the objective data dashboard works, you run the KPIs. Hold on one second, I think I just see Kevin. everyone. I just managed to grab Kevin for a minute or two, so it'll be a quick word on how it came to be that we decided the QI measures would be run via ODD.
Yeah, so not to get confused with the dashboard. So basically, in File, we have a functionality called key performance indicators. So the difference between key performance indicators and an object is that key performance indicators can do calculations. And that for the previous dashboard project, we used key performance indicators instead of find objects. So for the project, we decided to use key performance indicators as well. So what it does is it goes through the QI measures for, I guess you guys are doing child mental health right now, and it figures out all the patients who pass the criteria for the QI measures, and that's what the KPI does. And the patients who pass, they get put into patient groups. So this is similar to the dashboard. Does that make sense?
Thanks, Kevin. Yes, that definitely does. I guess you guys aren't able to show us anything right now because you're not set up.
That's my laptop.
Okay.
Good question. It's Tamara for
Hi.
Kevin. When you say pass, I'm not sure what you mean. Like I'm familiar with the KPIs, but I'm missing something when it comes to how you're using that with the
Sure. So if you look at the QI measures, I can't recall. I'll basically give you an example. This might not be an exact QI measure, but this is basically what they're looking for. So for example, did your patient have a GAT-7 with a score of doing this and that? And all patients who have a GAT-7 between the score of this and that, they get put into a patient group for that QI measure. And then, so in the KPIs, you can see how many patients pass and a percentage. And in the group, you actually have all of the patients listed. So if you want to then go in and set reminders for all these patients or set tasks for all these patients, you can do so that way.
Oh, that sounds good. So is there instructions as to how those KPIs are measuring data?
How they're measuring?
So yes, basically the specs that we received from PSP, we have a blurb in our KPIs. So if you, it's a dashboard where on the KPI screen, if you hover over the measure, it'll give you like a hover box, and it'll describe the calculation that it's doing. And with groups, once you go into the child mental health groups, if you hover over the QI measure, it'll tell you the calculation that it's looking for.
Fantastic, thank you.
And if you need something more detailed, that's something that PSP will have to provide. We've basically just taken their specs and we've implemented it, but for clinical reasons as to why the QI measures were made, that's something that PSP will have to provide.
Okay, you.
Yeah.
Thanks, Derek and Kevin. So I just wanted to offer to the group, maybe we'll talk with Kevin and Derek a little bit more, but it's possible that maybe it'd be valuable to have maybe just a separate session that might just look at what those reports look like for both the mental health modules, if there's an appetite for that. I don't know how familiar, like I can't really gauge either how familiar all of the PSP staff would be with the former objective data dashboard. So maybe I'll work with our team to see if there's a need there, and then if you guys are amenable, we can maybe plan a separate session.
We'd be good.
Okay. Me too. I did think we were going to take longer to get through it. I'm looking at the chat forum. There's no other questions that have come in. Is Does anyone else have any questions right now that we can answer? Okay. We didn't talk about access. I'm wondering, Derek, if you could just remind the group. So if a profile user is wanting to get access to these, the process for that.
So what we decided to do is that we're going to package all this up into Java files, and then we're going to put it up on our self-service center. So it's like downloading anything from our self-service. And what's going to be included in it is the 2 files for the documents, adult and child youth, also with two sets of forms, child and adult, and it will also include the term set, which will provide all the HR linking for all the forms, making them mineable. And then also on our self-service center, actually, Kelsey, maybe perhaps you could give your input on this. We have 2 manuals for both modules. One manual for each module. And I was wondering, do you think users would prefer it packaged together as one whole thing, or just the manual separate as well, also on the self-service center?
Good question. I'm gonna so we could follow up offline, but I'm thinking probably separately, because I know some physicians tend to have practice that is predominantly one or the other. But maybe we could follow up on that. The other thing I was going to ask is if we could get some kind of a PDF copy of that for our to have access to.
Definitely. You're talking the manuals, right?
Yeah.
Yeah, most definitely.
Great. Okay, well, that's very helpful. I certainly don't have any more questions. I'll just offer it one more time. Okay. All right, guys, we're finishing a bit early. That's good. Everyone can go back and add 15 minutes back to the morning. So all for taking the time. I just wanted to remind you that this is being recorded, so we'll have the link to the recording available shortly, and the other pieces that we talked about, the PDF copies, whatnot, will also be related. So thank you again.
Where will the recordings be available?
The recording is posted to the RST site on the Divot. So that's our PSD RST resource page on the Divot IT site.
Right. Okay. I know I had trouble accessing some of these recordings before.
Okay. Yeah. So I don't know if sometimes people aren't really familiar with it, or if the login info, if there might be challenges through some of the health authority firewalls. But the best point of contact for that is Carolyn Agek, and you can always shoot me an email and I can forward it to her. She can help you with your access.
Okay. Thank you.
Okay. Okay. Thanks, Derek. Thanks, Kevin. Thanks, everyone. Have a good day.
Thanks, everyone. Thanks, Kelsey.
Bye.
Bye.